So the skeletal system is going to include the bones of our bodies, which primarily are there to provide support and structure, but they're also there to provide a platform for your muscles to pull on. That's how we're able to move our bodies, is by moving our skeleton, by moving our bones. We'll also see that cartilage plays a role in the skeletal system. Not only are cartilages, or specifically hyaline cartilage, an embryonic forerunner or precursor to most of the bones of the body, but cartilages continue to cover the joint surfaces at all of our freely movable joints. A joint is defined as the meeting of two or more bones, or potentially where bone meets cartilage. For example, the ribs and all of their costal cartilages, that meeting will always be considered a joint. Ligament and tendons are part of the skeletal system, primarily to stabilize joints, to stabilize the meetings of two bones or bone to cartilage in some cases. Ligaments are going to hold bones together, so bone to bone is generally a ligament's job. Tendons are anchoring muscles to bone, but since all of your muscles are actually anchoring to bones, we'll find that those tendons play a role in stabilizing the skeletal joints as well. So ligaments and tendons are both made of the same material, dense regular connective tissue, which is a lot of collagen running parallel, right? So they're very, very strong collagen ropes, essentially. However, ligaments are defined as holding bone to bone versus a tendon, which is anchoring a muscle to a bone. The axial skeleton and the appendicular skeleton are the two main regions of our body. The axial skeleton, we've already started to take a look at in lab. It includes the skull, the vertebral column, 24 stacked vertebrae, plus a sacrum and a coccyx, and it also includes your thoracic cavity, or your thoracic bones. That includes the ribs, the sternum, and the clavicles. The appendicular skeleton is going to include the pelvic and shoulder girdles, so your scapula, your os coxa down here in the pelvis, as well as the bones of the arms and the bones of the legs, or the appendicular regions of the body. If you take a look at the appendicular bones, there are quite a few bones in the arms and the legs. However, arm bones and leg bones actually largely have a very similar repeating pattern. If you take a look, you have one big bone in your brachial region, that's your humerus. There's one big bone in your femoral region, that's your femur. There are two bones in your antebrachial region, your radius and your ulna. There are two bones in your lower leg crural region, your tibia and your fibula. We have 8 rock-like bones in our wrists. We call these carpals. And there are a bunch of rock-like bones in our ankle here and our heel. We call those the tarsals. The bones of the palm of our hand, there are 5 of them, 1 for each digit. Those are the metacarpals. Bones in the sole of the foot, we have 5 of those. Those are the metatarsals. The digits themselves have the same pattern. So we've got phalanges in our fingers and phalanges in our toes. And in fact, the number of phalanges is the same, or repeating, from fingers to toes. There are 2 phalanges in your thumbs, and there are 2 phalanges in your big toes. So the pollex and the hallux both contain 2 phalanges. All 4 other digits, digit 2, digit 3, digit 4, and digit 5, for both the manus and the pes, so manus is hand and pes is foot. For both of those organs or structures, we have 3 phalanges per digit. Again, for digits 2, 3, 4, and 5. Digit 1 again only has 2 phalanges, but the other 3 all have 3 phalanges. So if you take a look at the hit list, you will start to see this repeating pattern for arm bones and leg bones. And that does help when we start to identify not just the bones, but the structures of the bones for lab as well. Okay, so we're going to focus in lecture here on the tissues and the general structure of bone today. So the functions of the skeleton, of course, is support, but also movement. Now, bones don't move all by themselves, but the bones do provide these platforms for muscles to attach to. When your muscle attaches to your skeleton, it's always going to attach to two different bones or more and cross at least one joint so that movement can be achieved. It would not make sense for a muscle to be attached at the proximal end of the humerus and at the distal end of the humerus. When it contracts, no movement is going to be achieved if it's attached to the same bone. But if your muscle is attached to the humerus and then crosses the elbow and is attached to the ulna, when that muscle contracts, then it's going to move the elbow joint. So that's going to generate movement as our muscles attach to bones across at least one joint. Your bones also are going to be involved in blood formation. So your blood stem cells are hanging out in red bone marrow, and that's found in the spaces that we find inside of bone. We have a different kind of bone marrow that you may or may not have heard of before. It's called yellow marrow. Many of the long bones of our bodies are hollow, and that hollow space inside the shaft of a long bone is going to store energy in this form of adipose tissue or yellow marrow. Bones themselves are made of calcium and phosphate, and so we can actually tap into those stores of these minerals if calcium levels or phosphate levels in the blood begins to get out of homeostatic balance. So we can basically degrade or digest our bones if we need more calcium in the bloodstream. Or if calcium levels in the bloodstream are high, we can store that excess calcium in our bones. So we can use this to help us with homeostatic electrolyte balance for those two minerals. And then finally, phosphate does assist with maintaining appropriate pH in our body fluids. So by releasing or storing phosphates in our bones, we can help to maintain pH in our body fluids, including in our blood. So what is bone made of? So bone is a connective tissue. It's sometimes referred to as osseous tissue, or simply bone tissue is perfectly fine as well. And it's a connective tissue that's made of cells plus the extracellular matrix. Well, the extracellular matrix of bone is going to contain calcium hydroxyapatite crystals. This is the ground substance of bone. And this calcium hydroxyapatite is the mineral of bone. If you take a look at the bone's extracellular matrix, bone extracellular matrix is about 65% mineral and about 35% organic. Well, what's organic is the collagen fibers. Yes, bone contains collagen, and that's really important. This perfect balance of really hard mineral. I mean, think like rock. We're talking really hard mineral. Plus collagen is going to give our bone a little amount of flexibility and a large degree of strength. Now think about if your bone were 100% mineral, then it would shatter very, very easily. One jump would crush a bone, would shatter all of that mineral if you didn't have any collagen. But if your bone were all collagen, then of course collagen is very flexible. And so the cables and ropes of collagen would not be structurally strong enough to support the body's kind of structure and strength. So our bones would be wiggly. There's a little YouTube video, I'll see if I can find it to post, but the bone, you can kind of demonstrate this by digesting all the mineral. If you soak a bone in acid, it digests all of the calcium hydroxyapatite, and so the extracellular matrix is just left with collagen. You can take a bone like a femur and tie it in a knot. It's so flexible if it doesn't have any mineral. Likewise, if you baked a bone in an oven, then you would be basically denaturing all of the proteins in that bone, including the collagen fibers in the extracellular matrix. So by denaturing all that collagen, bone becomes very brittle. And you could take a femur, again, that's been baked in an oven, tap it on the table a couple times and you'll see it start to chip away, because without any collagen, there's no flexibility. There's no ability to withstand those kinds of forces. So we have this perfect combination of flexibility and strength by having our extracellular matrix be this nice combination of collagen, about 35% collagen and about 65% calcium crystals. And you don't need to remember for my class the exact name and formula of the calcium crystals. You might get to this in physiology. We can just call them calcium crystals. But I want you to recognize that this is what's giving bones ground substance, its really hard qualities. Now, bone tissue is always vascular and it is always innervated. So compare this to cartilage. Remember, cartilage was mostly avascular and lacked nerves. Bone, if you break it, it's going to hurt, right? There are nerves in there that are going to detect that pain. And it's going to bleed because the blood vessels will most likely be broken as well with a broken bone. However, the vascularity of bone is also going to speed up the healing time. It's much faster to heal bone than it is to heal cartilage. So if I had to pick one of the two, I'd rather break a bone than break some cartilage. Now, bone comes in two forms. You can see both forms actually in the little wedge that you're looking at over here. Compact bone is going to have a compact arrangement of the extracellular matrix with little to no space in between. In fact, all you're going to see for spaces are these tunnels, these tubes that provide a passageway for blood vessels. Spongy bone, on the other hand, forms this kind of network. They're referred to as the trabeculae of spongy bone. And spongy bone, it's not squishy. Don't let that word fool you. But it does look like a sponge with all these little pockets and all these little spaces. Well, spongy bone does provide the ability for our bones, the insides of our organs, to be able to hold marrow, to hold this fluid. So we do find that the spaces in between the bony network are generally going to be where we find our red bone marrow, which is where blood is produced. Blood cells are produced. So that word bone is an interesting word. It could refer to a tissue, as I was just mentioning, connective tissue, or the word bone could refer to an organ. Every single bone in your body, the humerus bone, the frontal bone, the scapula bone, the femur bone, the calcaneus bone, the patella, these bones are all individual organs. Remember that an organ is a group of tissues working together for a common purpose. Bone organs are dominated by bone connective tissue. That is the predominant tissue type that we find within our bones. But they also contain nervous tissue. Bones also contain blood tissue. Bones are going to contain cartilage covering the articulating surfaces if they're involved in a movable joint. Bones contain epithelial tissue, the endothelium lining the inside of these blood vessels is found within this bone. So the organ itself is going to contain a lot of tissue types. Adipose tissue in the yellow marrow, collagen or fibrous connective tissue, I should say, in the coverings on the outside and lining the inside of the hollow spaces of our bone. All of that is different tissue types all working together for each of these bones of our bodies. So I'll try to be clear when I'm referring to the word bone as a tissue versus referring to the word bone as an organ. So here we're looking at an organ, right? This organ that we're looking at is the femur. The femur, right over here on the far left-hand side of the screen, is fully intact. This is an anterior view of the femur. If you think about it, can you tell whether this is a right femur or a left femur? I'm going to give you a minute to think about it. Right? The femur has a few characteristics. This big head of the femur has to face the pelvic girdle, and down at the distal end of the femur, we see that there's a little patellar surface here that has to face the patella. So here we have the anterior view of the femur, and I know that the pelvic girdle has to be medial. So if this is a femur, it's got to be a right femur, the anterior view with the head facing medially. In this middle picture, the femur has been sliced along a coronal plane. Remember, coronal planes are separating our bodies into anterior and posterior parts. So we are looking at the posterior region of the femur here, separated or sliced along a coronal surface, along a coronal section. So the words here, the vocabulary that you're seeing on this screen, we're going to go through next. All of the long bones of our body are going to be longer than they are wide. The femur is the largest bone of the body, and it's definitely a great example of a long bone. But the diagram on the right over here, this is of a different bone. This is the humerus, the bone we find in your brachial region. In fact, a long bone doesn't have to be huge like the femur or the humerus. All of your metacarpals are considered long bones. All of your phalanges in your fingers, every single one of your little fingers kind of sections between knuckles contains a bone called a phalanx. The phalanx is also an example of a long bone, and all long bones are going to have these characteristics. So they're going to have an epiphysis. The epiphysis is the end of the long bone. The proximal epiphysis is closer to the point of attachment of the limb that long bone is found on, the arm or the leg. The distal epiphysis is further away from the point of attachment for that particular limb. So the proximal epiphysis of the humerus is going to be up closer to the shoulder. The distal epiphysis of the humerus is going to be down by the elbow. The diaphysis is the word we use for the shaft. So this is the long part of the long bone, the diaphysis of the femur and the diaphysis of the humerus here. I don't really do the metapiphysis in this class because it is more of a transition zone. The metapiphysis does exist, but really the clear demarcation of where is the metapiphysis versus the epiphysis and the diaphysis is a little bit too much of a blurry line for me to point out on any sort of exam for you. So on an exam, I would really only point out and expect you to be able to identify the proximal epiphysis, the distal epiphysis, and the diaphysis of any long bone. If we take a look at the inside of this femur that's been sliced along a coronal plane, you'll see that the femur is hollow inside its diaphysis. That hollow space inside of the diaphysis is called the medullary cavity. So this big medullary cavity, and also have one in the humerus, is where we store our yellow bone marrow. That's the adipose-rich marrow for energy storage. Having a medullary cavity also helps to lighten the load because the diaphysis is made of compact bone. And so if we have a hollow medullary cavity, then it's just a little less dense all the way around, while still being structurally strong. So this hollow cavity is a lot like a pipe, right? You're still pretty strong, whether it's a solid filled pipe or a pipe that is a hollow core, as long as it's made of structurally strong material, and bone certainly does have that strength. So the hollowness inside lightens our skeleton, it lightens our bones, and we're able to also store energy there in the medullary cavity. Within the epiphysis, you'll notice that bone has this spongy appearance, and that's where we find spongy bone tissue in the epiphysis. Now, the cavities of spongy bone is where we store the red bone marrow, which is responsible for blood cell production. All of your red blood cells and your white blood cells, they're all going to be originating here in the red bone marrow, again found in spongy bone. And for any long bone, the spongy bone will be found on the inside of the proximal epiphysis and on the inside of the distal epiphysis. And we don't see spongy bone on the surface because if you look very, very carefully, you'll notice that the surface is lined by a thin layer of compact bone. And that's what gives our bones the smooth appearance on the surface. But by slicing them open, you'll notice that the inside is made of spongy bone. Taking a look then at the epiphysis, you'll notice this line of compact bone running right around the metapiphysis region. This line of compact bone surrounded by spongy bone is referred to as the epiphyseal line. The epiphyseal line is the leftover of what used to be the epiphyseal growth plate in the bone of a child. As we age, our bones stop growing. And the reason that they stop growing is because the entire growth plate ossifies. We get this ossification of compact bone forming an epiphyseal line. As soon as that line appears, the long bone has stopped getting longer. We will find an epiphyseal line in both the proximal epiphysis as well as the distal epiphysis in all long bones of our bodies, of adults. A couple other characteristics to point out are shown best on the illustration on the far right. The surface of all of our bones, any surface that's not covered by hyaline cartilage, is covered by something called the periosteum. Now remember, cartilage, hyaline cartilage and elastic cartilage, had a perichondrium covering them. Well, osteo is going to be our bone-related root word. So peri is surrounding and osteo is bone. This is dense, irregular connective tissue that's surrounding the surface of our bone tissue, the periosteum. On the inside of the hollow spaces of bone, we have endosteum. Endo means within. So endosteum covers the inside of the medullary cavity. Endosteum wraps around all of the little trabeculae here of spongy bone. All bone tissue on the inside of any one of our bone organs will be lined or covered by endosteum, which again is the same stuff. It's dense, irregular connective tissue, just a thin sheet of it covering the inside hollow surfaces of our bone. We will find that bone, oftentimes you start to see these little holes. These little holes are they're called nutrient foramen, and they are there for arteries to be able to access bone. Remember, bone tissue is vascular, so we have nutrient arteries that get into the bone through these little nutrient foramen. So it's not uncommon to see small little holes on the surface of bone. That's going to be the nutrient foramen, allowing arteries to get in and veins to get out, essentially, of our bones.